to be refreshing too, and we hope to be seeing you in our subsequent presentations. So this morning we'll be having one of us present to us today on the topic dental neglect in children, a silent form of child abuse. I really don't know if you have heard the word child abuse, but today, this morning, a member of the college will be streamlining the topic to dental neglect in children. Please don't touch the dial. Make sure you're tuned with us as we invite her speak on speak on the topic. So I'll go ahead and invite her right away. Our presenter today is a registered dental therapist. She's also a content writer, a customer service specialist, and an IT support specialist. She currently have a higher national diploma in dental therapy, a diploma in IT support or customer service, and also a diploma in IT support fundamentals. She's running a mobile and online dental studio, Perfect Smile Dental Studio. She's also an IT support specialist and a customer service agent at My Home Bedroom Accessories. So this morning, Igbonekwu Oluebube Cynthia will be speaking to us on the topic dental neglect in children. But before she begins, I would like to plead with us, if you're in a noisy environment, kindly mute your environment so it doesn't distract the presenter during the presentation. Kindly use the mute button and mute yourself. When it's time for questions, you're free to ask your questions. So this is a paper presentation and it has been scrutinized. We will not be taking any corrections as regards to this paper, but questions and contributions are welcome, and this will be received at the end of the presentation. So what you will do for us is listen and also invite your friends to come join in the presentation. Thank you very much, and stay tuned as the presenter begins. Oluebube, the floor is yours.
Good morning, everybody, and my name is Igbonekwu Oluebube. Welcome to Oraposium this morning. Okay, today we'll be talking about dental neglect, a silent form of child abuse. Before we begin, this topic was actually inspired by an outreach I went for, and the rate of child neglect among the kids, the rate of caries was alarming. And what else are we even talking about? It was alarming that we had to start recording and calling some of their parents because most of their parents were not available. So today we'll be talking about it, and so we should know the extent dental neglect can lead in children. So this morning we'll be presenting under the following headlines. We'll have the introduction, definition of dental neglect, signs of dental neglect, risk factors for dental neglect, effect of dental neglect on the child, relationship between dental neglect and child abuse, legal implication of dental neglect, ways to prevent dental neglect, conclusion, then our references. Introduction. Dental neglect is a serious form of child abuse that occurs when a parent or guardian fails to provide their child with necessary dental care to maintain their oral health. This can include failing to take care of the child, failing to take the child for regular dental checkups, not brushing or flossing the child's teeth properly, and not providing the child with a healthy diet. Dental neglect has several consequences on a child's health and general well-being. What is this dental neglect we are talking about? The definition of dental neglect is, according to American Academy of Pediatric Dentistry, dental neglect is a willful failure of a parent or guardian, despite adequate access to care, to seek and follow through with necessary treatments to ensure a level of oral health essential for adequate function and freedom from pain and infection. So when a parent has the necessary means to take care of a child's oral health and at the same time fails to do so, and this leads to pain, infection, series of caries, that means the child's health is being neglected. There was a Facebook post that trended one certain time. What they wrote was the child entered the bus, the children, because they were siblings, on a Monday morning. And as they were speaking, someone from the person that made the post said they didn't brush their mouth and it was so obvious. As a parent, this is so obvious. And imagine the child getting to school and speaking to somebody else, and they will now be tagged that these kids always have smelling mouth because that's the word they will use. So what are the signs that a child's dental health is being neglected? The signs of dental neglect, we have extensive caries, including abscess and untreated decay, poor oral hygiene resulting in tartar, plaque accumulation, and halitosis, missed or delayed dental visits or appointments, inadequate access to dental care or use of dental hygiene products, visible trauma or dental injuries. These signs are rampant. There are some kids you see, they will have 10 to 5 carious teeth. What is happening? Are the parents not aware? Some kids will have injuries all over their mouth, and the parents are not doing anything about it. Most times they will just say it will fall out and have a new teeth. But honestly, is because you are abusing the child. The child is enduring pain, which is what child abuse does. Child abuse inflicts pain. So when you are leaving a child to have sores all over their mouth, they have carious regions all over their mouth, you are inducing pain on their body, and at the same time being abusive. So you may feel you are not abusing a child, but in the actual sense, you're actually abusing that child. What are the risk factors for dental neglect? What are the things that gives rise to dental neglect? So we have the socioeconomic factors. This includes poverty, low education, lack of access to healthcare. We have the parental factors, substance abuse, parents on substance abuse, mental health issues, history of child abuse or neglect. Most people, a parent that wasn't taken care of will also feel that it's actually not necessary. So we have the child factor. In the child factor, delayed, we have developmental delays, children with special needs, behavioral problems. This can lead to dental neglect because most special need children, they will not allow you to brush their teeth, they will not allow you to touch them, or they will start throwing tantrums. And because they draw and other factors involved, their oral health may not be actually taken care of 100%. So, what are the effects of dental neglect on the children? Why is it necessary? What does it cause to a child? So, in effect of dental neglect, we have the overall health. Dental neglect, because most times when we say overall health, they say the mouth is the gateway to the body, and anything affecting the mouth is affecting the whole body as well. So we have malnutrition, systemic infections, cardiac complications because of the tartar involved, and other diseases that the child have in their oral cavity. They end up swallowing and engulfing those inside their system. So the oral health effect of dental neglect, we have pain, infection, tooth loss, difficulty in eating and speaking, impaired facial development, and in the last but not least, the social effect of dental neglect, we have poor self-esteem, learning difficulties, etc. And someone will be like, what is now the relationship between this dental neglect and child abuse? How can I call dental neglect child abuse? Dental neglect is often associated with other forms of child abuse, such as physical, emotional, and sexual abuse, because kids who experience dental neglect are also likely to experience other forms of child abuse, because a child that is actually not well taken care of, you will notice. And the same thing, a child that is taken care of will not be having rampant caries or having halitosis at such a young age. So dental neglect also has the same risk factors as other forms of child abuse. And the last but not least, dental neglect in children is an indication that the child's basic need is not met, as well as the child's health is not prioritized by the parent or guardian. So if you are abusing your child, you are if you are neglecting your child's dental care, you as well as abusing that child. So in all this, someone is it my business? How does it concern me? Both as health practitioners, as parents, as guardians, it has legal implications. There are legal implications of dental neglect, and according to the Child Rights Act 2022, this for the US Child Rights Act that they brought out, there are legal implications of dental neglect for the parents or guardians. Parents or guardians who neglect their child's dental health may face legal consequences such as deprivation of custody, civil liability, criminal charges, and it will be treated as civil liability or criminal charges in some cases. And this will involve paying fines and sometimes imprisonment. Thus, this is to tell us the extent that child and dental neglect can be taken in the legal aspect. And for the dental practitioners, it's also our business because for practitioners who fail to report suspected dental neglect cases may face legal consequences. This includes fines, professional sanctions, or criminal charges as they have to protect the child patient's welfare. So as a practitioner, normal slogan, if you see something, say something. Because if you keep quiet, you are now becoming an accomplice to the child's oral health being neglected. What are the ways we can prevent dental neglect? There are several ways we can prevent dental neglect because it's our collective effort, both as parents, clinician, government, community members. We have to we have the duty to help the child because Igbo people will say one person doesn't train a child, and the child belongs to everybody, not actually for the parents or the guardian only. So for clinicians, create awareness for dental care, and oral health, as well as report any suspected cases. So what if, as a clinician, you've not spoken to somebody or a parent or a family, no single person about dental care, and the year is coming to an end. So maybe we'll put it on our New Year resolution to speak about dental care to all and sundry, so that this will help us to increase oral health awareness as well as reduce dental neglect. For community members, report any suspected case of dental neglect to the appropriate authorities, which include human rights, police, child protective service. Call or text the child help national line. Like there's a child abuse hotline, and it varies in countries. My church has a child abuse hotline that you can call and text at every point in time, and they will come to your rescue. This also goes to the government, the police. They will direct you to the necessary department that takes care of that. For government, because when we're starting, say it's the duty of everybody. It has been established that neglected oral health disease in children is a sign of dental neglect. So government can help in preventing it by introducing dental care services in primary health care centers. This is the major impact of dental primary health care center is to bring healthcare closer to people. So is our oral health not part of the healthcare we're talking about? So in this case, we beg the government they should, so that they will help us to bring introduce dental care into our primary health care. And even immunization officers can be trained to identify all these dental neglect and report to appropriate authorities. And for the parents or guardians, we should pay ramped attention to our children because they are our pride. They are in our care, in our custody. They can't do most of the things on their own. So we should pay ramped attention to them when they feel any pain, when they feel any discomfort. We should take it serious because most parents, mommy, my teeth is paining me. Sorry, sorry, and they will not talk about it again. And the child may play on and will forget about the issue at hand. So, this in conclusion, dental neglect is a tragedy and should be taken seriously by clinicians, parents, guardians, individuals, everybody to avoid the occurrence because these negative consequences have a detrimental impact on the child's overall health and well-being. We don't want to bring up children that will have low self-esteem. We don't want to bring up children that cannot speak to people in public or will not associate because their oral health is neglected and they have mouth odor or they have pains all over their body. They will not function well. They will not even function in well because they will not do well in school. Uh, Sorry, was I lost? I just found out that I was not speaking and my this one was not connected. Hello?
Your network actually went off during the course of the discussion. Probably you can start from the second to the
Sorry,
last
where
slide.
did I go? Where?
You can start from the second to the last slide.
Jesus, sorry, I didn't know. I didn't pay attention to that. I was just speaking. Okay, the ways to prevent dental neglect, am I right?
Yes.
Hey, so sorry for the break in transmission. I didn't notice. So, what are the ways to prevent dental neglect? According to Ramazi 2024, dental neglect requires our efforts. It's not actually not for somebody, it's actually not for the clinician or the parents alone. It requires the effort of everybody: parents, clinicians, government, community members, and therefore to prevent dental neglect, we must all join our hands together to prevent dental neglect. So for the clinicians, we create dental awareness for everybody, anywhere that we are, in our social media handle, physically in our church, because the year is coming to an end, and as a dental practitioner, some people have not spoken to people or even one single soul about oral health care outside the dental clinic, while we are supposed to be singing the praises of dental health. Because also as a clinician, we should create awareness as well as report any suspected case of dental neglect. For community members, we should report any case of dental neglect to the appropriate authorities. So, and this includes the human rights, police, child protective service. We can go to the police and they will refer us to the appropriate department. We can, in my church, we have a unit that is for child abuse, and once you call them, they come to your rescue. That's how it is. Even in schools, the guardians and counselors are there. There are different people you can report this case to because it's a form of child abuse. So we are calling on everybody that if you say something, if you see something, say something. That's the slogan. So, and also when we talk that it's for everybody, for the government, it's already established that dental neglect is one of the common signs of all the other oral health diseases. So we beg the government to introduce dental care to primary healthcare centers. The main role of primary healthcare centers is to bring healthcare to the common man, to bring it closer to our community doorsteps. So if the dental care is also not brought, is it not also part of our healthcare? So in this regard, we ask the government to plead, if even as a normal community health care worker, we can introduce it. When I did my internship, my NYSC, we were the second set that started the dental clinic. It was being introduced little by little, little by little. They were buying the equipment small, small. And at the end of the day, now they have a massive clinic at Akelere Health Center. But it was just introduced by mere core members. And this is one of the major effects of bringing primary healthcare. Everybody can easily walk in. It will be made available to all. So that's the sweetness and the goodness of bringing dental care to our primary healthcare center. Even immunization officers, because can be trained to identify oral dental neglect, because they are the ones that go closest to the children. There is no yet they don't take like 2 or 3 immunizations. And at the end of the day, we'll notice that these people have closer access to the children on a monthly, biannual, and most times when they come for their normal regular checkups. So they should be trained to identify dental neglect and report to appropriate authority when they see something. So for the parents, we should pay rapt attention to our children in any of their oral health care needs, because a child may come to the mom and be like, my teeth is paining me, and at the end of the day the parents may just say, hey, sorry about it, and that's the end. They may forget it. They will not speak about it. They will not do something again, and as kids they will just play and go on. So we should all join hands together and fight this tragedy that is called dental neglect, so that the next generation will have a proper oral health care, and there will be reduced case of dental diseases in the world. So in conclusion, dental neglect is a tragedy, and should be taken seriously by everybody, clinicians, parents, guardians, community members. This is to avoid the occurrence of these negative consequences because it can have a detrimental impact on the child's overall health and well-being. The child seed that is neglected will have low self-esteem because you cannot speak among your peers. Your teeth will be smelling. The boy has a smelling mouth. You know how kids are, and this will kill the child's self-esteem. And in return, the child will perform poorly in the society, in school, in his or her academics, just because he has a poor oral hygiene and the dental health is being neglected. So this is a clarion call for everybody. You're not You can do it as a clinician, as a oral health practitioner, as anybody that any position you find yourself. We should at all times watch out for our children and their oral health care needs because this is a clarion call for all and is a serious case. So thank you so much for listening, and I apologize for coming late. Sorry, I apologize, my sincere apologies, and thank you so much for listening. These are the references, and thank you so much.
Thank you very much, Oluebube, for that interesting presentation. Can anyone hear me?
Yes, I can
Yes.
hear you. Yes.
Okay, okay, that's good. Thank you very much, our presenter, for that interesting session. Though the network tried to distort the presentation, but I'm glad that we overcame. I believe for those joining us for the first time, or maybe you joined during the presentation before, or maybe in the course of the presentation, I hope you picked one or two things. This topic is not just for professionals, it's not just for dental professionals. This topic is for everyone. It's for everyone. As a parent, as a healthcare professional, whatever your profession is, you have a child, your siblings have a child, there are children all around you. In your workplace, your colleague have a child. So this education on dental neglect is what we want to pass across to as many persons as possible. This will help to reduce the cases of oral diseases in our society. Dental neglect in children can lead to a whole lot of dental diseases, such as dental caries. I know there are cases of children having periodontal diseases and also other oral conditions that can cause a lot of harm to them, and it can also affect their life if untreated. These are children. Some of them at school and they will have a break in their lip and they will have a broken teeth and they will come reporting this incident to the parent. The parent will be like, okay, it will be fine. Dental neglect is seen, especially in our community today. People don't value oral health because they feel oral health is some persons I've talked to, they will tell you that they will be fine after all, maybe in a couple of days, in a couple of weeks. Once the pain stops, they already believe that they are fine. That is how we see oral health. But what they really do not know is that it's a neglect in their own part, which can lead to other detrimental effects in the future. And when it comes to a child, I know that there are parents that don't joke with their children's health, but when it comes to dental health, the neglect is increased like in almost all the stratas, both the low, the high socioeconomic status. So is advised that we try as much as possible to educate these ones and to let them know the importance of good oral hygiene and assessment. Oral health assessment is very, very important. Even if your child do not complain of anything, take that child for an assessment once in a while, at least once in a year. But it's recommended you visit the dental clinic twice in a year. This neglect can be detected when you take your child during assessment, this neglect can be detected, and it will cause minimal harm at that point, because maybe the solution to that problem at that point may just be an invasive treatment and the child will be all right. So this undesirable outcome can adversely affect their learning. It can also affect their communication. Can anyone still hear me?
Yes, I can.
Yes, I
Okay,
can hear
okay,
you. Go
We
ahead.
okay,
can.
okay. I just want to know if you guys are following. Okay, I said this the undesirable outcomes can affect children's learning. It can affect them. They will be in school, they will not concentrate because they are having pain, because their gums are bleeding, because their mouth smells and their neighbor is complaining about it, because every one of them, every one of their friends are running away from them. It can affect a whole lot of things. And these are, as parents, as health caregivers, as um community health workers, this is what we should educate our clients. We should educate these little ones within and around us. It's very, very important. It can also affect their communication. You will see a child, the child will always be calm. They'll like, even like, this child doesn't talk. You don't know that this child is suffering from one thing or the other. And this communication is very, very important to children growing up. It can also affect their nutrition. Once you bring food, no, they don't want to eat. Why? Mommy, I'm having pains. And you will neglect it. It's very, very important to take all of these, their complaints, the complaints from these little ones serious, so that it don't impact their health in the future. Okay, we how can we do that? We can recognize and report this dental neglect. It's very important. Once you recognize it and you know you cannot handle it at that level, please report it to the appropriate quarters. As a healthcare professional, you can tell the parents of the child, this is what is happening. You can tell the teacher when you go for outreaches, you can report this to their teacher, write a note, give it across to all the children, take it to your parents. This is what is needed for you and it to be attended to. And some parents, when they receive that note, they'll be like, okay, I'll try and find time. There will not always be time. I'm always busy. But when pain eventually sets in, maybe excruciating pain, you see them running helter skelter. I don't know when it began, or I really don't know. But that's all lies. They really know when it began, but they will not always have time because there is no much pain. But once the pain is excruciating that there is no other means or a way out, they'll remember to go to the dental clinic. Dental going to the dental Going to the dental clinic is a necessity. Going for dental assessment is a necessity for everyone, not just for children, for everyone. Even if you can afford it, yes, we understand that the times are hard in our economy and in our society. Even if you can afford it twice in a year, at most once is very important. But yes, we tell our clients twice. But when you follow some of them up, some of them will eventually come back after 1 year. They will try to come back once. It's very important. And when they do, if there is any underlying dental health issues coming up, springing up, you tell the person and it will be taken care of. But they prefer to save the money for the later, save the money, the cost, the pain, and everything for the later use, which is very, very wrong. Okay. And just like I said, the consequences is far greater. So we should try as much as possible to together let's fight it to reduce these consequences in our little ones. It will even some of the poor performance we have in school, difficulty sleeping, loss of function, and a whole lot of it will help them to live a good life, enjoy their life now, and be able to attend to the next generation the same way they are being attended to. Okay, so it's time for questions. Like I told you earlier, we'll be entertaining questions. If you have any questions, our presenter for today is well enlightened and she has done her research on this topic. So if you have any confusion, any question, any contribution to this topic, please go ahead. Feel free, indicate, and you'll be allowed to speak. We just have a few minutes and this session will be concluded. So the floor is yours now. If you have any questions at all regarding this topic, any contribution, please go ahead. You can also use our chat box. You can drop a message if you cannot speak. Maybe you're in a noisy environment and you cannot speak. Feel free to use our chat box. This is Oracle community. The community is for you and I. It's not just for Oracle members. No, it's for you and I. So feel free to utilize every of the options available.
Thank you very much for that insightful and explosive discussion so far. Thank you so much. I just wanted to add a bit to what the presenter has already said. It is the fact that in this part of the world, we believe that providing for the child or for the children is only limited to food, clothing, housing, and the like. But we need to understand that the scope of parenting is beyond that idea. It is also extended to the fact that we need to be empathetic in terms of feeling what our child or our children feels. Most of us do not take care of our child oral health or general health just because we do not feel what they feel. I can remember this morning when I was coming to class, I met somebody, a guy. He walked up to me and said he's having dental pain, and since about 2 or 3 days now, he has not been thinking well. He could not sleep. You could imagine such kind of feelings, such kind of negative emotions running through the mind of a child. You understand? And at the end of the day, when the student grows up, you find out that they become notorious. Notorious in the sense that, on a personal note, I have done a kind of social experiment, and I found out that most of these touts that you see around, most of these people that you see around that do not have emotions, that do not feel anything for others, that cannot extend the arms of love to others, they were not born like that. They became so because of what they went through during the course of their childhood. Probably because when they were young, they were brought up in such a way that they need to feel like pain is a normal thing for them to feel. So when they grew up like that, they always want to have a feeling of pain all through their lives. And that is why you see some of these people, whenever you see them having some form of injuries and the like. They are not afraid of anything because their parents did not inculcate the act of love in their lives when they were growing up. So we understand that the country is not too friendly. We understand that it is quite difficult. But the life of your child and your children is more important than that job, than that business that you think you want to go and handle. So please, for this fact, let us start it as possible to ensure that we do the right thing always for the sake of our child and for the sake of the future of our family as well as the future of our dear country. Thank you so much.
Thank you very much, Ahmed, for that contribution. Thank you. I hope the message will be passed across. This presentation, this presentation we're having this morning will be live on our YouTube channel. So if you're not following Oracle channel on YouTube, please go right there and follow. And also you can take use the back session to check some of the uploads that we already have, some of interesting topics that we have uploaded in the channel, and get yourself updated. Get yourself updated as a healthcare professional, as a dental therapist, as a dental surgeon, as a health assistant. Get yourself updated. What we do here is not just for like the name implies, oral and public health. It's not just for oral health, okay? There are also public health related topics that we have treated. So I'm also waiting for you to contribute. If you have any contribution or question, please go ahead.
Good morning.
We have a few minutes. Good morning. Please, may we know your name?
I'm Gloria. I'm a registered dental therapist.
Okay.
I want to commend our speaker, Oluebube. That's a very good one. I have a question anyway. And,
Okay.
you know, children are likely to make a lot of noise and reject when it comes to oral hygiene procedures. Let's say toothbrushing. You know, I've had experiences with parents, and in fact, there was a couple that walked into the clinic And if you see the child's mouth, it was very poor. And I was wondering what happened. The mother said, if I'm trying to brush my child's teeth, she cries a lot. And the father would say, please leave her alone. So I want to ask, in trying to brush your child's teeth now, just to make sure that the oral hygiene is okay, the child's dental care is in a good condition, she's crying, she's wailing, can we also attribute that to a form of abuse? I don't know if you got my question.
Yes, I do.
So in trying to brush your child's teeth, she's crying, she's wailing, it's as if you are forcing him or her to do that. Is that also a form of abuse?
Okay, thank you very much for Gloria for that question. I would like our presenter to take on the question while we have other contributors from the fellows. Thank you.
Oh yeah, thank you. The one of my colleagues spoke about this topic of oral hygiene methods. So there are many methods that you can use to introduce oral hygiene to a child. So most kids, they don't like, nobody, if me that is talking as a child, I can remember I hated it, and it resulted to me having dental caries. And when my mom came to the clinic, what the doctor said was, although this is not applicable now, the doctor just said, is your child bigger than you? That was what he just said. Is he bigger than you? Like, can he overpower you in the normal circumstances? So the same way we had to get a way around to have our child take their medicine, have them take their bath, have them eat their food, because some kids don't eat. There are oral hygiene methods that we can use. We can introduce this silicone toothbrush. It makes brushing fun for them. We should make a toothbrushing time to be an interesting time. We don't have to make it to be boring like the normal way, as if they're doing a job or they're doing something else. So, as a parent, if the child is crying that he doesn't want to eat, is the parent trying to tell me that the child will not eat at the end of the day? No, they still find a way around to make the child to eat. Most times, kids are somehow, there are ways you make, like, these are the normal way. You can introduce brushing with cartoons. There are toothbrushing songs you can introduce. There are 1,000,001 ways you can get the child to brush her teeth. I think Kanye had a toothbrush she sold to one of my friend. I bought it from her, and since then I've not had issue with getting them to brush their teeth. They rush to even get the brush by themselves. There are toothpaste that have a nice. You can change their dental period. There are some toothpaste that are strawberry like. The kids rush to go and take the brush their teeth because the toothpaste has a strawberry like taste. There are ways you can introduce the cartoon. You can be brushing in front of them so they will see you are brushing it. You guys can brush together. And this makes toothbrushing very easy. And in the case that maybe they've refused or anything, you can introduce the cleaning method. I used the cleaning method until they started adapting with the this silicone method that the silicone brush that I got from Kani's store. So if you look at it like this, it's the duty of a parent to ensure that they brush their teeth at the end of the day, because if the child was not supposed to, if the child is a picky eater, they still find a way around it to feed the child. So Igbo people will say that the okra doesn't grow more than the tree. So we still find a way around it. Thank you so much.
All right, thank you very much. I appreciate
Thank
that.
you.
And I also
Um,
want to say our fathers in the house should encourage our mommies when we are doing that, because most times it brings up issues within the household. Thank you very
Exactly.
much.
Exactly.
yeah. I love
Everyone.
this one. It's a very interesting one. And I'm glad with the question you asked, and the response that she gave is also in line. And another thing I want to add to this is starting early. No, let me answer the question like this. No, it's not a form of child abuse. getting your child to brush his or her teeth is not and will never be a form of child abuse. So the best, first thing first is starting early. Most of our parents will leave our child until maybe they are 2 years, and you start introducing toothbrushing to that child. At that age, it's going to be difficult for them, for some kids, so to start learning how to, use how to brush every morning. Maybe they are, when they wake up in the morning, after beating them or before you beat them, trying to teach them how to brush, trying to spit out and all of that. Start early. Don't wait till your child clocks 2 years. Before your child gets to his or her 1 year birthday, introduce toothbrushes. There are this, even if you don't use a paste, give the child the toothbrush. The child can play around with it. Let the child know that this thing is not harmful. This thing can be fun. And just like the presenter said, introduce songs. Just like when they go to school, they learn ABCD. They come, they learn all these joyous songs. They come to the house, they sing it, and they are happy. Introduce dental songs to them. You can form these songs yourself. You can help your patient. And there is this thing I do. I have like 2 clients I do it for. Their children are having difficulty. They call me. I don't go in the morning. They will try their best in the morning, maybe later in the day or in the weekend. I'll come around. I'll play with the kids. I will tell them about the importance of toothbrush, and I will help them to brush. And with this, if you can't do it, employ the services of people that can do it. That is why we have trained professionals in the field that can do these things. Because some of these kids, they may not listen to their parents because of familiarity, but when they see someone else and when you tell them what to do, you find that some of our kids, they listen to what their teachers say more than what the parents tell them. So if they can get or afford the services of a dental care professionals, a dentist, a dental therapist to come to their homes, help their child overcome this, it will not even last up to, or let me say, a 1 week or 1 month. The person can book for a 1 month appointment. You come regularly. If the person can pay for morning, evening, or just morning, you come, you help the child. There are many methods the person can use to get the child to start brushing. So there are many ways to do this, but first and foremost, let's learn to start early and then make it fun for them. Don't hit them while they are doing it. Once they are not doing it right, correct them. Correct them. Do it this way. Spit out. Don't swallow. All of these things make it fun. Don't shout at them. At that early stage. I know it can be annoying at times, but what can we do? Patience. When it comes to children, we just have to be patient with them and for us to get the desired result. Thank you. Sorry, I am not taking so much of the time. Let's have other contributors in the house. If you have a question, please go ahead. We just have 11 more minutes to round up the session.
Good morning.
Good morning, Bethel.
Good morning.
Yes. I'm so happy to be here this morning. Thank you, our presenter, Oluebube. In fact, I thank God for the opportunity I have today. I've always longed to be in this class all the time, but due to my schedule, but today I'm glad. And I want to add to the question Gloria asked. Virtually all that have been said is in line, and from my own side, the way I handled my children, I think that silicone toothbrush again is another beautiful thing. And in buying toothbrush for children, I think them making their choice, even as they are growing. You start early, as Chani said, you start early. And when they start that early, like my children, once the first two comes out, I introduce toothbrush. So they get used to it. I don't add paste at that early stage. I still do my normal cleaning for them, but I give the brush. So the child plays around with it. With time, the child gets used to it. That now I don't even remind my children when to brush. They already know. And once their toothbrush is getting to 2 months, 3 months, I take them to the shop. They pick the ones they like. And them picking that one they like, you see that nobody reminds them to do the brushing. It's always a fun thing, and they play around while doing that. And at the end, you achieve what you want to achieve. So I just want to add to that, taking the child along in buying toothbrush and paste is another thing, because there are pictures, there are images in toothbrushes they like. The last one I got for my children, in fact, they were the ones that selected it. It has this thing that they stick with it on the table. So they selected that one, and they're always happy to go to that toothbrush. Anytime it is time for brushing, they're always happy to have access to that toothbrush, play around with it, brush. So I think it will help again. Thank you very much. Thank
Thank
you.
you very much, Bethel. That's another interesting contribution. Honestly, for those that missed this presentation, please don't forget to go to our YouTube and play it again. Download it and share. So after this session today, please, you help us share this topic. It's very, very important, not just as health professionals. This topic is very, very important to all parents, to all caregivers, to whatever your profession is. You need this because you definitely have contact with children. It's very, very important. Thank you for the contribution. Their choice of toothbrush and toothpaste is also important. So you pay close attention to these little details. It will also help in
Thank you.
minimizing.
Can I ask a question?
Please go ahead and ask a question, Mary Rose.
All right, thank you everyone. Actually, this is my first time joining a discussion like this.
You're
Thank
welcome.
you, President Ebube and the host Chanice. Actually, the discussion is a very important one. I can remember those days in dental school. Dental therapists usually I used to see them go to schools for oral health care education. I don't know if they still do that now. I don't know, but I believe it's still ongoing. If you notice now, children are very, very intelligent now. You see some children self teaching their parents. It's now children that teach parents. When they go to school, they learn all these things. I'll tell you, dentists came to our school. They will even teach the parents how to brush, how to do all those things. Because most times these parents don't even know, because of their background, the way they grew up, their own style of, because poverty and all those things. There are lots of factors that's contributing to that. I'm using my own parents as an example, so I had to teach them. So if you see, children nowadays are very wise. They are the ones teaching the parents now on all this oral health hygiene. Then my question is for Miss Oluebube. I'm surprised actually. I never knew that there is a, what do they call it, a police, child abuse police or something. I know that there is, but I don't know if there is any. Have you heard of any arrest or any sanction or penalty for, has there been any case of someone reporting a parent about child's oral health? I don't know if you, maybe during your research when you were preparing for this presentation, did you read or have you heard of anything like that, like someone that has reported to the police about a child's oral health?
Okay, thank you very much, Mary Rose, for the question. The presenter, please, we have just a few minutes to attend to this question while we take the next one. We'll round it up.
Thank you so much, Mary Rose. But in the course of the research, the one of the indications of child abuse happens to be linking to dental neglect. Is like every child that was reported for abuse had like the probability, they will say on a scale of or the probability of the child having this thing was 4 to 10, which is on a high rate. So anybody, I use mainly the Child Rights Act. They have people called for neglect, child neglect in general, and dental neglect. If you read the Child Rights Act, you can just click on the link on the reference. It will bring up the Child Rights Act. You see cases of it, and the parents are being forced to do something to take care of the child. And if this persists, what happens at the end of the day? The custody of the child is being taken from the parents. So he is there. Check the Child Rights Act on the I think is the last reference there. And you see it. Okay. Thank you.
Okay, thank you very much. I don't know who is in a noisy environment is interfering with the presentation by one. Please, can you mute yourself? I think for developed countries it happens, but for Nigeria, these are some of the things we are bringing in, and we can't just introduce this. There are things we should put in place before all of these are introduced, and that is why, as researchers, it's important we submit our findings to the necessary bodies. This will help them, and you can also work you can also work hand in hand with them to bring some of the results, or maybe inculcate some of these findings, the right one, to maybe our society, our health system, to help to improve our health sector. So this is very, very important. The last but not the least, if you have any question or contribution, I'll just be taking one more person before we call it a day today. Just one more person, and it's going to be brief. One more person, a question.
Well done, ma'am. I just quickly wanted to add something about the first question that was asked earlier on about whether or not it was a child abuse or it's a child abuse when a parent is trying to brush for the child and the child is crying and the likes. Now, the truth is this: we need to understand that these children are very intelligent. They will always want to dominate the decisions in the house in between themselves and the parents. So the parents should always understand that these children also have their differences in terms of their personality types and the likes. Then also, being children, we need to familiarize them with a lot of materials that are fun to do with, to act with. Like, for example, we now have toy-like toothbrushes. We have toothbrushes that are made in such a way that it has.
Hello, Ahmed. I think we lost him to network. Okay, while we wait for him to join us again, thank you very much, every one of us that joined in today's presentation, Oraposium 44.0. Thank you for joining us today, but we cannot call it a day without appreciating the founder and the founder of this great community, Dr. V.E. Adamo. He has been an inspiration and a blessing to us, the fellows, to the members, and also to the society. Thank you very much, sir, for bringing us together into one umbrella to learn. You know, now we are interacting, we are becoming friends. Okay, so these are the things, communication, these are the things that is necessary, that is important, networking in life. You connect with people, you communicate with them, and opportunities, you can get opportunities from these connections and communications. And the one that Oracle has given us is immense. Like, we are grateful, and it has really helped us a lot, and it's helping us. So for those that are joining us today, you're welcome to Oracle. We hope to see you in our subsequent presentation. Please don't miss it. And then again, invite your friends to join the session. That is what we ask for, is a free program. Invite your friends to join, to come and learn, because these informations are very useful. It's very, very useful. So please help us invite your colleagues, your friends, share it, share our flyers, follow all our social media handles to get notified when we have other presentations. We want to appreciate also our presenter for today. That was a very interesting topic, honestly speaking, and I enjoyed it. Thank you very much to everyone that contributed. To the fellows in the house, you're welcome. To the members of the college, we love you. And to those joining us and those that have been joining us and those that joined us today for the first time. We look forward to seeing you again. We love everyone and we appreciate your contributions. Please, the program, as we want to round it off now, you can also use the chat box if you have any questions. Please, you can use the chat box. Okay, you can use the chat box to drop your questions. I can see there are other contributions in the chat box. I'm so sorry I didn't look at it, but let me quickly rush through it. Mr. Samuel said he commended the presenter for the insightful presentation. It is informative. We also need to promote medical dental integration and incorporation of dental care services in primary health care to ensure that there is awareness and access at all levels of care. That is very important. And Spice Girl, she has a very good name, said, I would like to thank the presenter of this beautiful topic. It was very enlightening. I would like to advise our mothers to not make toothbrushing and flossing look like a punishment or serious chore. Some mothers put the child in the middle of their legs and brush forcefully while the child struggles. Thank you, Spice Girl. That is actually the truth. And the next day, the child will run away and will not want to brush. Please, let's not do that. Even as some of us are parents, young parents, please let's not do that. Mrs. NIFN just said, thank you, Mrs. Igbonekwu, for this beautiful presentation. I would like to say that we are all stakeholders in ensuring that we avoid child abuse. Another aspect of child abuse we should fight against is the notion that when a child has any form of toothache or issues, that since it's not on the temporal tooth, they let the child endure such until the permanent tooth emerges. Some say there is no need to treat any issue on temporal tooth since the permanent one will soon replace it. Yes, I've heard that numerous times. And I'll be like, who said so? They was, oh, they went to this place and they told them. No, please. Let the child get the appropriate care at the moment. Don't allow the child endure that pain for God knows when the permanent will start erupting. Please, let's stop it. Um, she also mentioned about children brush. We can show them pictures of bad tooth or teeth and let them know that if they don't brush, they would have such teeth. This will motivate them to brush. That's very, very important. Honestly, there is a whole lot of things. We may not even exhaust it if we start mentioning it. And I know that we have mentioned that many of it. Please, it's very important. Our mentor said, thank you, Oluebube, for the revealing, relatable, please, you can read that at the end of the day. But thank you very much, everyone. He's thanking every one of us for joining. We appreciate you. Do have a very beautiful Saturday, and we pray that your day will be blessed. And we hope to see you next time. Bye.
Bye bye.
Bye.